Happy Puja. Today we are going to talk about how to look after our breast. Number one, the choice of body line has to be appropriate, as in support system, material used, and the design used. Very often we tend to wear loose body lines, and sometimes they are too tight, as in sports body line. So the choice of body line and the choice of gloves needed to palpate the breast has to be carefully selected. I will show you. This is an ordinary gloves. This is just not appropriate to wear to examine the breast because it is flimsy. You can see it here. It is flimsy. Now, when you examine the breast in a clockwise fashion or anti-clockwise, this is just not going to perceive. But a lady should have a proper gloves in the washroom to examine her breast clockwise, anti-clockwise, and in the axilla, underarm, because we are descendants of chimpanzees and we have only two breasts, but chimpanzees and gorillas had multiple along the arm, which got dissolved, and we were retaining only two breasts. Some women are known to have axillary mammary gland, and this is obvious when they are pregnant. When the breast milk secretion is active, then these glands become appropriate. Now let me tell you about the choice of good gloves which is needed to palpate the breast. That is this quality of gloves which, when worn in the hands, is very sensitive to feel nodules, to feel generalized swelling, to feel small lymph nodes. They are very sensitive. I wish you could palpate it and see the sensitivity of this glove and this glove. Likewise, you have to identify which body line is suitable for you. Young girls wear iron-based body line. Now, iron-based body line can cause trauma to the breast by the side. The iron pokes in. If you wear nylon bra, then due to electricity generated between the skin and the bra, there is hair growth. So ladies develop hair around the nipple area and areolar region, which is quite disturbing for a young girl. So choice of material should be cotton. And support. If it is too tight, there will be circulation hamper, and this would lead to pain. This would lead to discomfort. So, point number one, choice of body line, choice of gloves. Point number two, whatever problem you face in the uterus is reflected in the breast. So, if you have a growth in the uterus, the corresponding breast will also complain of pain, tenderness. Very often you've heard women saying that during periods her breast becomes heavy. She is unable to touch her breast. This becomes heightened if she is a nervous person, if she is upset, if she is stressed. So the pain becomes heightened. So you have to take care to dismantle your stress, to have proper night's sleep, to have correct bowel movements, which will make you agile, light and free. Now, when you are a corporate woman or have a lot of corporate stress, the breasts do speak loud, as in pain prior to periods, during periods, and after periods. There are two benign conditions which are commonly seen. One is fibroadenosis, where there is a diffuse heaviness in the breast which cannot be felt by the palm of the hand but is felt by the tip of the fingers. And this needs to be addressed, and you have to consult a gynecologist for this condition. Sometimes this diffuse condition gets organized to a solitary benign tumor that is called fibroadenoma. So we, as a routine, when a lady comes to us for breast checkup, we also ascertain and evaluate her uterine integrity by doing a local per-vaginal examination to rule out fibroid or ovarian disorder. Once this is ruled out, we advise the lady to become de-stressed by taking up some creative hobbies which would divert her attention and would give her a different thought process. So these are two benign conditions. Then how does the breast talk to us? The breast talks to us as in pain, as in a lump, as in itching around the areola, or there would be skin retraction, or the nipple would retract, or the nipple would discharge by giving a yellow colored secretion, green colored secretion, or maybe just white colored secretion. If so, she needs to be evaluated. Her prolactin level has to be evaluated. Is she undergoing stress? Is she too occupied with the mobile in the night and goes to sleep at about 2-3 in the morning and then has a whole day of stress, target and goals? So these are rightly timely interventions which are needed for the benign disorder, along with gloves, along with right choice of body line, and along with this association between the breast and the uterus. Now we move on to evaluating and checking the breast once in a year after 40 years of age by ultrasonography or a mammography to evaluate if there is anything which has been overlooked by the lady. Once this is done, we are sure that she is fine and fit. I would just like to touch on teenage. Sometimes the teenagers have small breasts and they are very conscious, and they want to have growth in the right place. For such teenagers, you should press the wall with the palm of your hand to develop the serratus anterior muscle, which would give a rounded contour to your body. If your breast is too large, then you should wear sports bra with the lower margin being thick and able to carry the load. These are two advices I would like to share with my teenage friends. And breaststroke in swimming would also encourage enhancement of small breast. So these are few tips you should keep in mind. And please, please, please do not wear nylon body lines or synthetic body lines. Go in for simplicity. Simplicity does not go wrong. So if at all you have any questions, any queries to ask, you are most welcome to address it to Kotari, and we would be ready to share with you people whatever your queries are. Thank you.